Hello, my name is Professor Christina DeSario, and today I'll be talking to you about the heart. Specifically, we'll be looking at the structures of the heart using this heart model here. I'll be talking more about the functions of the heart in a separate video. Now, the heart is a muscular pump, and it pumps blood out to either the lungs from the right side of the heart or to the rest of the body, or we say systemic circulation, from the left side of the heart. Now, when we first look at the heart, when we look at it in the thoracic cavity, we notice that it sits just left of midline. So not right in the middle of the thoracic cavity, but just left to midline, between the pleural cavities that house the lungs. We'll also notice that the heart sits, again, just left of midline, so it's kind of cutting into that space where the left lung is. And because of that, instead of the left lung having 3 lobes like the right lung does, it only has 2 lobes. And it also has this structure called the cardiac notch, where this left side of the heart kind of sits in where that other part of the lung would be if that cardiac notch wasn't there. We'll also notice that the heart, now we'll be doing a pig dissection next week, excuse me. And when we do that dissection, we'll notice that the heart is covered by a structure. So it'll be hard to see it at first. In fact, we'll have to cut it away with scissors. And then we'll tear it apart, right, with some force. And that's going to be your pericardium. Remember that your pericardium has 2 layers. And it has the fibrous parietal pericardium. And then it has that inner layer, the visceral pericardium. Now, important to note before we move forward is that the visceral pericardium is actually so connected to the heart that when we do our dissection, we won't be able to pull it off. It'll be really adhered to it. What we'll be cutting away is what we call the parietal pericardium, or that big fibrous pericardium that's thick. And like I said, fibrous, it's tough, so it's very protective. Now, once we cut it away, we'll be able to see the actual heart. And now that's what I'll be talking about for the rest of this video. The heart has 2 major regions that I want to talk about before I talk about the lobes, and that's the base and the apex. The base is this part up here. It's not the bottom, that's where people get confused. It's not the bottom of the heart, it's up here, it's this part. It's where the vessels connect to the heart. The apex is the point down here. Then we notice that we have 4 major lobes. We have 2 atria and we have 2 ventricles. We have the right atrium, which notice extends around to the back. All of this here is the right atrium. Sorry, let me show. There you go. All of this here in pink is the right atrium. Over here, we have the left atrium. And again, notice that it extends to the back. Look at all of that back here. This is the left atrium. Don't forget that, because I may label the back of the heart and expect you to understand that this is the left atrium and this is the right atrium. The atria collect the blood. They collect blood. And from there, it will drop down into the ventricles, the blood well. We have the right ventricle and the left ventricle. Now, an interesting thing to notice here is that the atria actually hold about the same amount of blood as the ventricles. And that makes sense, right? Because the blood has to be collected here in the atria before it feeds down into the ventricles. Now, again, one of the ways that it does that, or one of the ways that we can explain this extra volume that we can't see from the front, is that a lot of the volume is kind of back here, The other thing is that they have these little flappy looking weird fishy alien things here. Okay, you see these? These are called auricles. We have a right auricle and a left auricle. Okay, and again, these will kind of expand out, giving more volume to the atria. Now, like I said, the blood will drop down from the atria into the ventricles. Okay. We want to look at this structure right here, though, before we go further. Okay. This structure here, this is a sulcus, right? Remember from AP1, we said that we have hills and valleys. We have sulci and gyri. A sulcus is like a little valley. Okay, so we have one right here in the front, and this is called our anterior interventricular sulcus. Now that makes sense because it's the anterior portion of the heart, and it's a sulcus, okay? It's also interventricular because it's right here dividing up essentially, or in line with where we'll divide up the right and the left ventricles. Also, when we look at the back of the heart, you'll see that we have a posterior interventricular sulcus here. Again, marked by these vessels coming down it and this layer of fat here. We'll see that whenever we have these sulci, we also have this layer of fat that's kind of protective, okay? So anterior interventricular sulcus in the front and posterior interventricular sulcus in the back. Now, we are going to talk about some of the vessels that are connected to the heart, but we are not going to be talking about these vessels today. These vessels are part of something called our coronary circulation, and that's the blood that's going to be feeding the heart muscle of the heart itself. We'll talk about that in a separate video. Today, we're going to talk about these big guys up here. So the first one we want to look at is this structure right here, okay? This is called our superior vena cava. The superior vena cava is taking that oxygen poor blood from systemic circulation or from the rest of the body, and it's going to drop it into the right atrium here. So again, this is oxygen poor blood. You'll also see we have this guy here at the bottom. This is our inferior vena cava. Now we don't see the rest of it because in fact it's a long tube that's gonna, kind of extend downwards, okay? So we just see this part of it here. So that's the inferior vena cava, and we can see that that also feeds right into the right atrium. So both of these veins, because they're bringing blood to the heart, okay? Both of these veins will bring the blood into the right atrium. From there, we say the blood is going to go into the right ventricle, right? So superior vena cava and inferior vena cava brings the oxygen poor blood into the right atrium. Then it goes into the right ventricle. From there, we're going to pump that ventricle, right? We contract that muscle, and that's going to pump this blood out to the lungs. Because it's extending from the heart to the lungs, this and what it connects to here, this is an artery, okay? This is called the pulmonary trunk, and let me angle it toward you here, the pulmonary trunk. And you can see the pulmonary trunk connects to the right ventricle. And then it splits here in the back into the left and the right pulmonary arteries, okay? Left pulmonary artery, right pulmonary artery. These arteries will bring that oxygen poor blood out to the lungs. Now notice here that contrary to popular opinion, arteries do not always carry oxygen-rich blood. In this case, it's oxygen-poor blood. It's an artery because it's bringing blood from the heart to another location, okay? But in fact, it's oxygen poor blood, because remember, we dumped this oxygen poor blood into the right atrium, that went into the right ventricle, and then we pump it out and we bring it to the lungs. When it goes to the lungs, it's going to pick up that oxygen, become, oxygen rich, and then come back through these structures here. Okay, so it goes out through these pulmonary arteries, and then it comes back through these. We have the superior and inferior pulmonary veins. These would be the left superior and inferior pulmonary veins. And these are the right superior and inferior pulmonary veins. Okay, again, the right superior and inferior pulmonary veins. And notice that the veins are bringing this oxygen-rich blood from the lungs back to the heart. It will dump this oxygen-rich blood into the left atrium. From the left atrium, will go into the left ventricle. And then the oxygen-rich blood will be pumped from the left ventricle out through this structure here, and this is our aorta. The aorta brings the blood from the left ventricle out to systemic circulation, or out to the rest of the body. The aorta has three major parts that I want to talk about today, and the rest of the vessel portion we'll talk about when we get to blood vessels. We have the ascending aorta, which is this part right here that goes up. We have the aortic arch, which is this arching portion here. And then this right here is just the very start of the descending aorta. Now let's look at the inside of the heart. Actually, let's start up here first. If we look inside the atria, we can see, okay, look at that. How cool is that? Okay. When we look inside the, what did I say before? Did I say aorta? Okay. When we look inside the atrium, we see some muscles here, okay, or some ridges here. This is called the pectinate muscle. Pectinate muscle. Compare this to the muscles inside the ventricles, okay? Remember, I just took this off of here, okay? So we're looking at the ventricles. The muscle of the ventricles, this is called trabeculae carnae. Trabeculae carnae. We've seen that word trabeculae before, and remember we saw it when we looked at spongy bone, and they're kind of these like weird, like curvy structures. It kind of looks like that, right? It kind of looks like these weird curvy structures. And then carne, like carne asada, like meat, right? Because it's meaty, okay? So trabeculae carnae, that's only in the ventricles. Pectinate muscles is found in the atria, okay? Now, looking inside the ventricles, we see that we have four different valves that we'll talk about, okay? We have two semilunar valves and two atrioventricular valves. The atrioventricular valves are so named because they connect the atria to the ventricles, right? So that makes sense, atrioventricular. You can notice them very easily by these dangly white bits that are coming off of the ventricles. The semilunar valves look like that. They don't have dangly white bits, okay? So these are the atrioventricular valves, or AV valves. You have one on each side, okay? So you have one that's connecting the right atrium to the right ventricle, and one that's connecting the left atrium to the left ventricle. The one on the right side is called the tricuspid valve because it has three little cusps. And the one on the left is called the bicuspid valve, or also named the mitral valve because it has two cusps. These dangly bits that I mentioned are called chordae tendineae, or tendinous cords. These are attached to something called a papillary muscle. You can see it kind of shown right here. It's actually quite a big little muscle here, right? And it's attached directly to these tendinous cords, or chordae tendineae. And that's going to be very important because we said that it's these ventricles that pump the blood out to the lungs or out to the rest of the body. And so that's a significant amount of force or pressure that's exerted. And when that happens, we don't want that blood to go backwards into the atria. So to prevent that, these papillary muscles will anchor these chordae tendineae. That way they don't go back into the atria and allow that blood to go backwards, right? Instead, it will push that blood out through these structures. These structures, okay, are semilunar valves. Okay, so let's look at our semilunar valves now. We have two semilunar valves that we'll talk about. We have this one here and this one here. This one is connecting our right ventricle, okay, so our right ventricle over here, to the pulmonary trunk. So we name it the pulmonary semilunar valve. This one connects our left ventricle to our aorta. So the blood, when we contract the ventricle, will go up through this valve into the aorta. So we call this the aortic semilunar valve. For short, I'm fine if you just want to put aortic valve on your practical. Notice that both of these valves do not have these chordae tendineae attached to them. They also don't have papillary muscles. That's because these guys on the backside of these cusps here, or the backside of these little pieces, okay, it's like a little cup, okay? And the pressure of the blood pushing out will go out through here. But then when the ventricle relaxes, the blood, like if you imagine you have a bunch of blood up here in the aorta, and the ventricle is contracting, and then it relaxes, some of that blood that's in here will kind of drop down. The valve will close, and that blood will kind of collect a little bit in there, being kind of holding that valve down. Okay. All right. Now, this big structure here, so that was it for the valves, by the way. If I do ask you about both of them collectively, say if I'm asking about both of the semilunar valves, then you would use semilunar valve. If I'm asking about one in particular, then you would give me its name, right? So for example, you'd give me the pulmonary valve or the aortic valve. Same thing for the AV valves or the atrioventricular valves. If I'm talking about them collectively, then you'd use AV valve, or for the practical exam, you'd spell it out, atrioventricular valve. If I'm talking about one specifically, again, that would be your tricuspid valve, and this would be your bicuspid or mitral valve. Again, you can use either one. Now we'll move on to other structures. So here we're looking at the interventricular septum of the heart. This is so named because it is just like we have in our nose, right? Remember, we have this septum in our nose. It kind of divides up our nostrils. You can think of it like that, okay? It divides up the ventricles of the heart. So it makes sense. It's very aptly named, interventricular, okay, septum. Sometimes you'll see it just abbreviated as septum, though for my exam, I do expect you to use the full name, interventricular septum. Notice also that we have various layers of the heart muscle, okay? We have the myocardium. This is this major muscle here, okay? And we talk mostly about the myocardium. That's this red stuff, all this meaty stuff, right? That's the myocardium. This pink layer, okay, that's the endocardium. Remember, endo meaning within, right? So inside. And then on the outside, we have the epicardium, That's the outside layer of the heart, the external layer of the heart. And notice before, I said that we had a visceral pericardium and that it's very adhered to the heart. In fact, that's the same thing as the epicardium, okay? So it really just depends on your frame of reference and how we're talking about it. If we're talking about the heart, we may call it that external kind of shiny layer on the outside, the epicardium. If we're talking about the pericardium, then we may call it the visceral pericardium. All right, now I believe that's everything I wanted to talk about. So again, happy studying, and I will see you for our lecture on coronary circulation.